Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
I want to first of all hear from you regarding the status of COVID-19.
Right now, we have seen that the continent has been hit quite seriously by the COVID-19. In fact, if you look at what we call the case fatality, meaning the number of people dying out of the tests done, Africa has probably the highest case fatality against other countries. That could be a reflection of the low testing, and therefore the deaths are high compared to the tests done, because when you measure case fatality, you're measuring only the tests done and the people who died out of the ones who are positive. Because we also know that the tests are low, we are under-testing, and we're also under-reporting death.
You put out a statement and you think it is time to reduce mask mandates and accelerate vaccine access in Africa. Why do you say this?
If you look at all the tools that we are using for COVID-19, we say, socially distance. Then we say that you need to wash your hands regularly. And then we say, you need to wear your masks. And then the government had also other population level restrictions like curfew. Uganda had closed schools for a very long time, and now they are reinstated. We have seen that some countries had partial lockdown, no movement. But all these tools are aimed at reducing the force of transmission. None of them is aimed at eliminating the virus. They are all for reducing the force of transmission. The only one that is actually can say is intended to reduce the virus and probably eliminate it is vaccination, because once you have everyone with immunity, then the vaccine doesn't have a host to survive in, because the body is hostile through vaccination. Now, all these others should then be used according to the effectiveness and when they are most needed, other than vaccination, which then should continue so that everyone is vaccinated. Curfews were lifted when the cases dropped. Schools were returned when the cases dropped. But the masks also then, as a tool, also need to be reviewed. If you see many countries now, the positivity rate is under 1%. In Kenya, we are having 0.5%, meaning it's 1 in 200 people. So masks are most effective when the cases are rising, so they protect you from meeting somebody who is infected and getting infected. And that's the same thing for social distance. So I am asking that the mandates for masks should also be reviewed and should only be used when they are most effective, because you know what? They have a cost. Masks cost money. People don't have the money to buy and make a decision not to go to work or make a decision not to go to the hospital if they need care. And also they have a cost to the environment because of disposal. So every tool needs to be reviewed when it is most necessary. And that's why I'm asking for us to review mask mandates as well.
Our test positivity rate is also well below 1%, around there. It oscillates between 1.5 and below. And we were told that we are now out of the third wave. What do you have to say for organizations that are still holding on to measures like use of masks and those stringent measures for prevention of COVID-19?
Mandatory mask wearing should be reviewed and moved to discretionary mask wearing, so that then even the companies then follow suit. But the government, the policymakers need to take suit and say, based on this positivity, we are recommending that mask wearing is discretionary, and we are recommending that risk still exists, especially if you are going to go to closed door public places, like social places, or you're going to church and there is crowding. But it should be discretionary, and the government needs to take lead in this conversation.
Okay, considering the challenges to acquisition of vaccines, how should acceleration be done? So
the challenge that we are having with vaccines is that Africa has been left behind in terms of access to vaccines. Ability to buy, because Africa has a small economy, and Africa spends maybe only $30 per person per year on the entire health system in terms of public money. If the government spends only $30 per person per year, it means that for the government to vaccinate everybody, and yet the vaccines are costing $15 for 2 doses, it means you have to use the entire half budget of the entire health system to provide vaccines to everybody, which is not tenable. So we need to look at financing mechanisms, which is obviously to work with a COVID vaccine facility. Those countries can afford need to buy. But most importantly is that Africa needs to look at manufacturing its own vaccines for the future. We have seen Africa Centers for Disease Control and the Africa Union take this strongly, create the partnership for vaccine manufacturing in Africa, start to drive manufacturing. Actually, South Africa now is manufacturing vaccines, J&J, and they're manufacturing, my target is 60 million a year. We need to accelerate other centers and then also see how are these vaccines going to be shared across the continent so they don't get manufactured and again get exported to Europe and other places. But we also need to accelerate in-country inequity. I can imagine that in Uganda, the vaccination rate in a place like Barara or Kampala is different from the vaccination rate in the north, so in Gulu and other places. So we need also close the gaps in country so that we are not just saying there is hesitancy. We need to increase convenient access everywhere, even as the supply increases. We must continuously review what policy guidelines we make. And therefore, we must look at, for example, when is it necessary to do PCR testing at the border, for example? What are the mandates for vaccination? What should people be told and how should people who are not vaccinated behave? Because this is becoming a pandemic of the unvaccinated. The pandemic of the vaccinated is over. And I think we need to say that clearly, that the pandemic of the vaccinated is over. We are now starting the pandemic of the unvaccinated.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in